I went into orthopedics because I always enjoyed sports, and when I first came to Macon, I started covering the high schools here, and we ended up covering them for the next 25 years. We cover Mercer University here. We're on the sidelines for every games and provide the physical examinations for all the student athletes. And we also cover the professional baseball teams here because I have a baseball past, and I have always enjoyed that. I came back to Macon in 1977, and Frank Kelly came the next year. We had trained in different places, he at the Campbell Clinic in Memphis and me at Johns Hopkins in Baltimore. But I was very impressed with the way we had similar approaches to patient care. And it's really, when you come from different training programs, it's not always that way. But we've been together now for 32 years, and we have never had a cross word. I think the world of Frank. He is the epitome of what a doctor should be. And having said that, I will admit that I've taught him almost everything he knows. When I first came to Macon, I did a little bit of everything, but I gradually evolved toward spine surgery and feet. And I don't know why feet, because a lot of people don't like dealing with them, but I always have enjoyed it very much. It's not a fetish, it's just something I enjoy. I became involved with the diabetic feet more because the wound center here in Macon couldn't find many doctors that were willing to do feet that were from diabetics because they tend to be not as attractive as total joints, and a lot of them require amputations, and it's more of a social process than it is a surgical process to walk a patient through that mindset where they realize that they'll be better off with an artificial leg than they would be with an infected foot. And the diabetics that you work on really seem to be very appreciative of what you do for them. The technology on backs has evolved tremendously over the last 25 years. When I was a resident, when we operated on backs, they would be in bed for weeks and sometimes months. Now they're up the next day walking due to the technology. We do most of the back surgery at the hospital because most of the backs require at least an overnight stay, if not longer. And I think the rehab is at least half of the process of getting a back patient well. The surgery is one half and the rehab is the other half because of weak muscles. I think we have one of the best physical therapy facilities in the state. It is just excellent in the way they handle it. Tommy Williamson is our head therapist there, and he has brought in a great staff of people, and I always know when I send somebody to him, they're going to come back better than when they started. I used to work in the Crippled Children's Clinic here in Macon for 20 years, and I'm now seeing children of those crippled children that bring them back to see me. There's no reason to go outside of Macon to get medical care. If I were getting operated on, I would want to do it in my hometown where I'd have my family around me, and if I had a problem, I could go back to that doctor on a moment's notice and not have to drive an extended period of time.